Madeline Reed, and I'm going to be showing you how to take a manual blood pressure. So first you're going to need a blood pressure cuff, and you're going to need to measure it by making sure that the blood pressure cuff is at least 80% of your person's arm circumference, which this one is. Typically an adult size cuff will work. You also need to make sure that you have a sphygmometer and an inflatable bulb, and that it is turned all the way to the right and that it will inflate your cuff. And before, you also need to make sure that you know what your patient's normal blood pressure is and pump the cuff up 20 over that. You also are going to need a stethoscope to listen. You're going to listen to their brachial pulse, which is going to be pinky side, inside elbow. You also want to make sure that your patient's legs are uncrossed because it can alter the reading. And make sure that they don't have a history of hypertension or hypotension, which is high or low blood pressure. On most blood pressure cuffs, there's going to be a arrow that says artery line, and you want to make sure and line that up. You want to get the blood pressure cuff tight, but not too tight, and make sure that your patient is comfortable. Just relax your arm. When you put your stethoscope on, you need to make sure that the earbuds are facing towards your nose and that the bell's turned on by just tapping it. If it's not, you can turn it and make sure that's on. You want to place the bottom of your stethoscope right under the cuff. Sometimes you can hear the pulse, but it might be faint, but you usually hear it as you pump it up. So earlier she told me that her blood pressure was normal, which is 120 over 80. So I'm just going to pump it up to around 140. Well, I've got it turned all the way to the right, and I'm just going to start inflating. I'm going to slowly release. The first noise I hear is going to be the systolic pressure, which is the number on top. So for her, I got about 118 over 78, which is close to normal. So like I said earlier, when you pump it up, the first number that you're going to hear is the systolic pressure, which is the number on top. When it goes silent, that is your diastolic pressure, which is the bottom. You'll hear it when it goes silent, but you need to make sure that you listen to it all the way till it gets to 0, because sometimes it won't focus. But sometimes the heart will come back up, and you'll miss that if you don't listen. That's how you take a manual blood pressure. Thanks for listening.